So let us start the practical class, and this one is the ninth practical class. In this we are going to discuss the GLP. The full form of GLP is the good laboratory practices or good laboratory practice. So the objective of the ninth number practical is the concept of good laboratory practices that we are going to discuss. First, we have to go through the definition of good laboratory practices. The name itself is telling something. It is about the work in the laboratory and which should be followed in a good manner. So here the good manner means we have to perform the laboratory work judicially. So if you want to define it or the what is the meaning of good laboratory practices, you have to go through the word and then you will define. So what is this? GLP is the method which is carried out in the laboratory for safety purpose as well as the work should be performed in the laboratory judicially. So this is about the GLP. Other definition that also are very important are good laboratory practices are not only a set of guidelines, rather it is a force of law which will give the assurance or ensure that the work that has been performed in the laboratory are high quality standard. So this is about the GLP. GLP is not only concerned to the production, but it is also about the quality control. So this is all about the, you can say not only the definition, the detail about the concept of GLP. Now we have to go through the what the European Commission has cited about the or stated about the GLP. Regarding that, according to European Commission, under the principle of GLP, it promote quality, very important. It promote quality and the validity of data that is generated in the lab about the chemical, and therefore it check the fraudulent practices. So this is very important. What it means, whatsoever you are performing the work in the laboratory, that the data generated there should be validated, or you can say the judicious one, in which we are testing a chemical, and that should not have any fraudulent practices. So this is about the principle under the GLP according to the European Commission. Now we have to go through the another word, non-clinical GLP. So name itself is telling, if you want to tell the what is clinical GLP, what is non-clinical GLP. In non-clinical GLP, we are mainly concerned to the experimental research in the laboratory. So we are whatsoever we are performing the research work in the laboratory is coming under the non-clinical GLP, and that is not concerned to the human patient care like human blood test or whatsoever we are doing the practices other than human patient care are called non-clinical GLP. So in simple one word, The work or the research work that are performing in a laboratory or research laboratory are called non-clinical GLP, and which is not related to human patient care is called non-clinical GLP. So what is the aim of GLP? What the GLP is telling? It is ensuring the consistency. It is also ensuring the reliability, ensuring the uniformity, ensuring the quality of chemical under the non-clinical test. So these all under the GLP, ensuring that the results should be consistent, results should be reliable, results should be uniform. So the data will be reproducible. So what is the main aim of GLP? It ensure the consistency of the result, and the result will be reproducible in any of the lab as per the protocol published. Other point regarding the non-clinical GLP is that GLP promote quality and validity of test data. Also, under the lab compliances, GLP deals with the organization, with the process, with the condition under which the research work has been performed, planned, performed, monitored, recorded, and reported. So these all are coming under the non-clinical GLP. That means कि whatsoever you are performing the work in as a research work in a laboratory, this should be validated and reproducible, is called non-clinical GLP, and the research work, or you can say other than human patient care work performing in the lab, is called non-clinical GLP. Now we have to go through the history of the GLP, how that word, the term came in existence about the GLP. So regarding GLP is concerned, the word good laboratory practices first time used in two country, rather you can say one country, but I found the mention in two country, that is New Zealand and Denmark, and the term GLP came in the existence in 1970s, and in New Zealand in the year 1972 they used the word GLP. So the term GLP was used in the country like New Zealand and the Denmark in the in the 1970s. And New Zealand was the country who introduced this GLP first time in the history in the year 1972. So you can say the New Zealand was the first country to introduce the concept of GLP in the laboratory, and thereafter United States in the year 1978 they introduced the concept of GLP, and the law has been formulated, and that has been circulated, and that was obeyed in different laboratory of the US in the year 1979. So the year 1978 and 1979, the in the country United States they used GLP, the concept of GLP. the regarding the United States is concerned, why the country United States they introduced this GLP concept because of many scandal happened in United States in 1970s, and one of the important scandal was in industrial biotest laboratory, that is called in short form IBT lab. And because of that United States was bound to introduce the concept of GLP for research work as well as for the work concerned to the human. So this what was the actually problem? The IBT lab that was that was performing extensive scientific work, that was actually the fraud. So he was doing fraud. The result was uh, keeping aside and whatsoever the want of the other company, they produce the result accordingly. So that was the problem, and that was become a fraud. And thereafter, in the year 1978, United States has introduced this concept of GLP. As per the organization like OECD, that is the Organization for Economic Cooperation and Development, he gave the concept or principle of GLP, and that is obeyed as a international standard, and those countries that are coming under the OECD, they all obeying the principle of GLP. So now we are going to discuss what was the problem happen in the United States by the IBT lab, that we are going to discuss in the region behind the GLP creation. Actually, why this GLP get created, particularly concerned to the United States, because of fraudulent in the IBT lab, industrial biotest lab. What happened in that lab? Not only this lab, about 40 labs in United States, they are doing the scientific work, but the result was not reliable, and also it was fraud. It was fraud. So therefore, United States they started investigation, and they found that the IBT lab, he was performing the scientific work for many big name fame company like Procter and Gamble and other company also. And what he did, actually he was doing work on the cosmetics, and the lotion and the deodorant that used in over the mice, experimental animal mice. What the result was telling, result was that because of the use of that test cosmetic, the mice get died because of the cancer. But even though the IBT lab thrown the mice and gave the good result in favor of that Procter and Gamble company. And he told the product is safe for the human consumption. And because of that, thereafter, many concerned person in that laboratory served the jail time, get jailed and perform the jail time. So thereafter, in the same 1970s, States has introduced the concept of GLP to validate the data as well as the validate the research work as per the OECD guideline under the principle. Whereas United States, the Food and Drug Administration, they also frame the laws, particularly in concern to the GLP, and they introduced in the year 1979. So what was the poor practices that found in the lab at that time? The poor practices that found at that time in the lab like IBT was equipment was not even calibrated. So if the equipment was not calibrated, then how will you will get the measurement accurately? So the measurement of the equipment was wrong. Also, inaccurate lab study. This is very, very important. Inaccurate lab study. As well as it was also found the test system was inadequate. So these are the uh, problem of the poor lab practices found at that time in 1970s. Now we have to go through the what are the objective of the GLP. Regarding the objective of GLP is concerned, GLP is making sure that the data that generated are the true reflection of result. So this is very, very important. The data that are generated in the research laboratory are the true reflection of the result. Not only that, that is also international acceptance. The data is international acceptance and traceable as well as reproducible. So these are the objective of the GLP that we already discussed. Now we have to go through the last point under the GLP is the what are the key component of the GLP, or you can say what is the basic element that you have to take considered in the GLP that we are going to discuss. So the basic element or the key component of the GLP are first, personnel. So personnel that are engaged in GLP that are well educated, well trained, well experienced, have a good resume, and the lab must have detail about the personnel that working in the lab, have their good training, and the record should be maintained in that laboratory. The person that engaged in GLP should also review and follow the protocol that we call it SOP, a standard operating protocol. What it means, the personnel that are involved in that are involved in the research work under the guideline of GLP, they have to follow a particular experimental protocol that should be written that we call a standard operating procedure. So when you are operating a particular standard operating procedure, therefore it should be reproducible. Therefore it should be reproducible. Now the second point under the key component or elements of the GLP is the test facility management. So under the test facility management, the management have to designate a study director. So management has to assign a study director, means a director, a study director, as well as it also designate a quality assurance unit. So under this facility management, the two point has to be mentioned, has to assign, has to designate the study director, as well as it also go through the quality assurance unit that monitor the GLP study. So these 2 points has to be considered under the test facility management. Now we are going to go through the detail of the study director. A study director of that particular study have to give all the compliance under the GLP. This is very, very important. Also, they are going to generate a particular protocol or SOP, or they are going to give all the detail about that particular study or particular experiment, as well as the director has to comply all the GLP details. Now we have to go through the second point, quality assurance unit. Quality assurance unit has to assure, and that should be independent unit, and that should inspect the study at regular interval and keep the data, so that ensure that quality assurance unit has to ensure the management of about the facility, about the equipment, about the personnel working there, about the method, about the practices, about the record, about the control. So quality assurance should be independent unit, and they have to take care of all the detail and report it and file it, so that the quality should be maintained. Quality assurance unit maintain written document about these mentioned things that I have mentioned about the facility, about the personnel, about the equipment, about the SOP, about every detail. They have to maintain the record and the date of the inspection, and they have to report the management and the study director, and review the final report. So this is about the quality assurance unit. Now we have to go through the facility under the GLP. So facility must be suitable site. The construction and design is adequate, and so that any to prevent the any adverse effect. So the GLP study must be of suitable site, as well as the construction and design are of adequate degree or adequate facility, so that chances of the adverse effect should be minimized. So this is about the facility in the GLP. Now we have to go through the equipment. Equipment used in GLP should be appropriate design, adequate capacity, well maintained, and the most important among all these points is routinely calibrated. So equipment should be routinely calibrated, well maintained, so that the measurement should be accurate. So this is important. Now we have to go through the test facility of operation. So when the personnel is going to perform the research work in the laboratory, they must have the standard operating procedure in written form, and that written SOP should be accurate and current, also approved, available, and reviewed. So this has to be monitored. Now we have to go through the protocol. So protocol should be in a written form and clearly indicate about the objective, clearly written about all the method of the study, and it is also written about the sponsor, about the study director, and about the protocol, and a study must be conducted in accordance to SOP or protocol that we have in written form. After performing the experiment as per the GLP, we have to maintain the records and report. So all data should be in written form and it should be maintained as a record and report in well documented form and should be retained, should be kept for up to the time that has been mentioned in the or as per the GLP requirement. So data that has been generated in the laboratory research work that should be recorded, that should be reported, and that should be kept till the time as mentioned in as per the GLP requirement. That should be a store and archiving. So a storing and archiving of the record in a well manner so that when it should be required, we have to retrieve the data and report. Now we have to go through the analysis of the data. So analysis of the data that we have generated in the laboratory, in the research work, that should be statistically analyzed by a standard method. So this is very, very important. Now, next is the test and control article. So under this test and control article that used as a reference substance that should be as per as the OECD principle because this is very very important and that we are using as a standard and you can say that we are using as a reference substance. So that is very very important and we have to use this one as to calibrate the instrument that we have to use to calibrate the instrument. Now we have to go through the analyst certification. So whatsoever the acceptable proof of satisfactory training we have to maintain it. Now we have to go through the laboratory certification. Laboratory certification in which we are performing the laboratory work or the research work that should be done by the external agency and in this certification we have to mainly consider about the laboratory about a space adequate space about the ventilation of the lab about the storage of the lab and the hygiene that maintain in the lab. So this is very very important about the laboratory certification and it should be always done through the external agency. Now we already discussed about the documentation and maintenance of the record. So if it will required for legal challenges, we have to show it. So we have to keep it. Now this is very very important. The 2 points are important. That is about the disqualification of the facility. Another point is the instatement of the disqualified facility. So these 2 points we have to discuss. Regarding the disqualification of the facility is concerned, we have to disqualify the lab if the lab is not going to comply. If the lab is not going to comply about the GLP protocol, whether they are following or not, if they are not going to comply, then the disqualification of the facility has to be performed. So before a workplace can experience the consequence of non-compliance, an explanation of disqualification is needed. And FDA stated that the disqualification should be only initiated when there is none complied by the lab. Okay, and which may include under the disqualification if the particular lab is not going to tell about the truth of the permit of the work, registration of the work, and any concern record that is under the that work. So if the particular laboratory is not going to give the correct information about these things that I have mentioned regarding permit, regarding registration, regarding to start the work, regarding the protocol, regarding the ingredient, regarding the observation, everything about the work, if they are not going to give the data to the authority, then the disqualification, particularly FDA, particularly for the United States. FDA state. So then they have to give the disqualification of facility. Then if the FDA think that the reinstate of the disqualification has to be done, then for that, the condition is that test facility may be reinstated as acceptable non-clinical study if the FDA or the commissioner is thinking that after that the lab should lab should comply, then they have to give the or reinstate the disqualification, reinstate the give the permission to do the work. So this is all about the ninth class under the practical, that is the GLP, and in next class we are going to discuss next practical. So this is all about the GLP.